Picture this, a seemingly ordinary day until an unexpected twist occurs. That's the reality for countless women who may experience the subtle yet potentially life-threatening signs of a stroke. As we embark on this enlightening expedition, we'll uncover the unseen symptoms that often elude common knowledge. Because understanding the nuances of these symptoms isn't just about awareness, it's about empowerment, preparedness, and saving lives. Today, we're unraveling the mysteries surrounding strokes, those silent adversaries that can strike unexpectedly. In this eye-opening exploration, we'll shed light on why recognizing stroke symptoms in women is not just crucial, but can be the difference between life and life-altering consequences. Together, we'll explore the importance of swift recognition and the unique signs specific to women. Stay tuned for a tapestry of knowledge that could be the key to safeguarding the well-being of the women in your life. 1. A stroke, often referred to as a brain attack, occurs when the blood supply to the brain is disrupted. 1. This interruption can be caused by a clot blocking a blood vessel, ischemic stroke, or a vessel bursting, hemorrhagic stroke. 1. The result: brain cells are deprived of oxygen, leading to potential damage or even death. 5. So as we uncover the hidden signs specific to women, keep in mind the urgency embedded in this information. Fam, it's not just knowledge, it's a call to action. 5. Understanding the urgency of recognizing and responding promptly to stroke symptoms is the first line of defense against the unseen adversary we're about to unveil. 1. Sudden numbness or weakness in the face, arm, or leg. 1. Let's break this down in simple terms. 1. Imagine your body as a team and the brain is the coach giving instructions. 1. Now, if there's a sudden numbness or weakness in your face, arm, or leg, it's like some players on your team aren't responding to the coach's signals. 3. For example, your smile might look a bit wonky, one arm might feel like it's not quite cooperating, or a leg could be a bit wobbly. 3. This is a clear signal that something's off, and it could be the early warning signs of a stroke. 5. Remember, it's not about toughing it out. 5. If you notice sudden numbness or weakness in your face, arm, or leg, or you see someone else experiencing these, it's time to call for help. 5. Quick action is like calling in the MVPs to get your team back in the game. 5. Don't underestimate the power of recognizing and responding swiftly to these signs. 2. Confusion, difficulty speaking, or trouble understanding speech. 1. Now let's talk about the brain's communication center. 1. Imagine it's like a busy control room where messages are constantly being sent and received. 1. If there's confusion, trouble speaking, or difficulty understanding speech, it's like the messages are getting mixed up or lost in translation. 2. This can manifest as suddenly having trouble forming words, slurring speech, or not understanding what others are saying. 2. It's like the brain's communication highway is experiencing heavy traffic or roadblocks. 3. Understanding the impact of language difficulties is crucial. 3. If you or someone you know is suddenly struggling with words or understanding speech, treat it as a red flag. 3. Don't hesitate, seek help promptly. 3. It could be a key to preventing further complications. 3. Severe headache with an unknown cause. 1. We all get headaches now and then, right? But if you experience a severe headache with an unknown cause, it's like a warning siren going off. 1. This isn't your typical headache, it's the body's way of signaling that something more serious might be happening. 2. Differentiating between routine headaches and stroke-related headaches is vital. Stroke-related headaches often come on suddenly and intensely, like a thunderstorm in your head. 2. It's not just the pain, it's the unusual nature of it. 2. If you're unsure or the headache feels different from what you're used to, it's better to err on the side of caution and seek medical attention. 3. Remember, not all headaches are created equal, and being able to tell the difference could be critical in recognizing the signs of a stroke. In addition to the more commonly known signs, women may also experience unique and often overlooked indicators of a stroke. Because these symptoms are unique to women, it may be difficult to immediately connect them to stroke. This can delay treatment, which may hinder recovery. These can include nausea or vomiting, hiccups, trouble breathing, pain, fainting or loss of consciousness, and a general sense of weakness. Recognizing these subtle cues is essential for a comprehensive understanding of stroke symptoms in women. A. Nausea or vomiting. 1. It might surprise you, but nausea or vomiting can be subtle signals that something might be awry in the brain. 1. Exploring the link between digestive symptoms and stroke is like connecting the dots. The brain and the stomach communicate, and when one is affected, the other might react. 1. If you or someone you know experiences unexplained nausea or vomiting, especially alongside other unusual symptoms, it's a clue that should not be ignored. B. Seizures. 1. Seizures may not be the first thing that comes to mind when thinking about strokes, but there's a connection. 1. Understanding how seizures may be associated with a stroke is like decoding a hidden message. 1. When the brain's electrical activity goes haywire, it can manifest as seizures, and this can be a sign of an underlying issue, including a potential stroke. 1. Recognizing and addressing seizures promptly is crucial in the broader context of stroke awareness. See hiccups and shortness of breath. 1. Now let's shed light on the more unconventional indicators, hiccups and shortness of breath. 1. These seemingly ordinary issues might be easily overlooked, but in the context of stroke, they can be important warning signs. 1. Hiccups and shortness of breath are like the body's distress signals, indicating that something might be affecting the nervous system. 1. If you or someone you know experiences these alongside other unexpected symptoms, it's time to pay attention and seek medical advice. 1. Sometimes it's the small, unusual clues that can make a big difference in recognizing and responding to a potential stroke. D. Trouble breathing. 1. Trouble breathing might seem unrelated, but in the realm of stroke signs, it's a noteworthy indicator. 1. Recognizing respiratory difficulties as potential signs of a stroke is akin to understanding that the brain and lungs are closely connected. 1. If you find yourself or someone else suddenly struggling to catch a breath without an apparent cause, it's time to consider the possibility of a stroke and seek immediate medical attention. E. Pain. 1. Pain can take many forms, and when it comes to strokes, it's essential to be aware of the various types. 1. Discussing various types of pain that may accompany a stroke is like navigating through a complex map of sensations. Whether it's a sudden and severe headache or other unexplained pains in the body, they can be warning signs that something is amiss. 1. Understanding and differentiating these pain signals is crucial for early detection and intervention. F. Fainting or loss of consciousness. 1. Fainting or sudden loss of consciousness is a clear signal that something serious might be happening. On highlighting the significance of sudden loss of consciousness is like putting a spotlight on a critical moment. 1. When the brain is affected to the point of causing a person to lose consciousness, it's an urgent situation. 1. If you witness someone fainting or experiencing a sudden loss of consciousness, treat it as a medical emergency and seek help promptly. G. General weakness. 1. Addressing overall bodily weakness as a potential warning sign is like recognizing that the body is sending distress signals. 1. General weakness can manifest as a sudden lack of strength or energy, affecting various parts of the body. 1. If you or someone you know experiences an unexplained and persistent sense of weakness, it's a sign that warrants attention. 1. Understanding these nuanced signs can be crucial in identifying a stroke, especially in its early stages. H. Symptoms of an altered mental status. 1. Sometimes a stroke can show itself through unusual behaviors like sudden drowsiness. 1. When someone acts strangely or differently, clinicians refer to it as altered mental status. This includes things like not responding, feeling lost or confused, sudden changes in behavior, becoming agitated, or even seeing or hearing things that aren't there, hallucination. These signs are like red flags that something might be going on in the brain, and they fall under the category of altered mental status, which is crucial for both individuals and those around them to recognize and act upon promptly. One of the best shields against strokes is a healthy lifestyle. Stressing the importance of adopting a healthy lifestyle is like building a fortress for your well-being. Eating nutritious meals, staying active, and managing stress are powerful ways to fortify your body against potential stroke risks. Small changes in daily habits can have a big impact on long-term health. 1. To empower women in their health journey, we're providing practical tips for reducing stroke risk. 1. These include maintaining a healthy weight, keeping blood pressure in check, managing diabetes, and avoiding excessive alcohol consumption. Education is a potent weapon, and by understanding and implementing these strategies, women can take proactive steps in minimizing their risk of experiencing a stroke. Regular health checkups are like routine maintenance for your body. Encouraging these checkups and overall awareness is crucial. By staying connected with healthcare professionals, individuals can monitor and manage their health effectively. Awareness coupled with regular checkups is a powerful combination for early detection and prevention. Recapping the key points, we've explored the common and unseen signs of the stroke in women, emphasizing the urgency of recognizing and responding promptly. These signs include not only the physical, but also the behavioral and mental indicators that may go unnoticed. Urging our viewers to share this vital information with their female friends and family is a collective responsibility, creating a network of support and awareness. We encourage you to learn more, stay informed, and proactively spread stroke awareness. By becoming advocates for your own health and that of others, we can collectively make a significant impact in the fight against strokes. Remember, knowledge is a powerful tool, and together we can save lives. We express our heartfelt gratitude for your viewership. Your commitment to understanding and sharing this information is a step towards a healthier and more informed community. We invite your comments, questions, and further discussion. Your engagement is valuable to us. Don't forget to subscribe and enable notifications for upcoming informative content. Together, let's continue this journey of knowledge and awareness. Stay well, stay informed, and take care of yourselves and your loved ones. Until next time, thank you and goodbye.